Hello, everyone. Welcome to Lifestyle Matters. My name is Dr. Fergal Armstrong, and we have with us Ms. Charmy Cheng of the Dietitian's Kitchen. And this episode has been brought to you in association with CareVersity Health. So, Charmy, I thought we'd talk today about celiac disease.
That's right, yes.
So, what's your understanding of celiac disease?
Well, my understanding celiac disease is like an autoimmune disease, and there's currently no
Mhm.
treatment can cure this disease. And the treatment for these people who have celiac disease will need to follow a lifelong gluten-free diet. Am I correct?
Absolutely, yeah. So, from my point of view, celiac disease it's an inflammatory response triggered by an immune reaction to gluten. So, gluten is a product of the breakdown of complex carbohydrates. So, it's found in rye, oats, barley, in wheat. Yeah, and that's the key thing. So, you get this kind of inflammatory reaction that then attacks the small intestine, and so you get something called villus atrophy. So the structures that act as the absorptive sponges, if you will, for all the nutrients in the duodenum, they kind of wither and die as a result of this inflammatory response, and that has a number of downstream effects, predominantly gastrointestinal. So you end up with effectively bloating, diarrhea, nausea, pain. And you end up with the complications associated with that, and primarily malabsorption. And so, if you've got malabsorption, you have difficult to flush away stools. You don't absorb fats. You don't absorb fat soluble vitamins such as A, D, E, and K. And lack of vitamin D can have downstream effects on your bones. It can, because it's a chronic inflammatory condition of the gut. It's also associated with an increased risk of gut lymphoma. There are also, interestingly, extra gastrointestinal manifestations of celiac disease. So you can have associated conditions like autoimmune thyroiditis. You can have type 1 diabetes. It's more common in people with Down syndrome and Turner syndrome. It can cause atrophic glossitis, so it can cause an inflammation of the tongue. It's associated with a specific type of skin rash called dermatitis herpetiformis. Sorry, I'll repeat that. It's associated with a specific type of skin rash called dermatitis herpetiformis. And it can also be associated with neuropsychiatric phenomena. Now, a lot of people will say they get brain fog as a result of having celiac disease or gluten intolerance. I'm not so sure that the evidence is absolutely supportive of that, but what we do know is that a large number of patients with celiac disease develop what is known as a peripheral neuropathy, so that the nerves in their hands and their feet may not work as well. So there's a number of risk factors, and there's a number of manifestations, and the basic physiology is basically this immune reaction to gluten,
Mhm.
which is found in rye, oats, barley, and wheat. So that's my understanding of celiac disease. What's your role as a dietitian in helping people with celiac disease?
Mm. So, as a dietitian, when we see patients who have the symptoms that you mentioned before, then we will definitely red flags them because they might
Hmm.
potentially have celiac disease, but also it may be different types of bowel issues. So we just need to red
Hmm.
flag these symptoms when they have it, and then we will pass to the GP, communicate with other health professionals because that only the specialist can give the diagnosis if they have celiac disease or not. But definitely,
Yeah, that's an important point.
mm,
Yeah, I mean, I see a lot of people who think that they've got gluten intolerance, and you do the blood tests to look for
yeah.
the signs of celiac, and actually they're all fine. And I think a lot of them actually have irritable bowel syndrome, and so when they go on a FODMAPs diet, which by definition is a gluten-free diet, they actually feel better.
Yes, so some of the people, if they have IBS, sometimes when they avoid the
Yeah.
glutens, they do reduce the symptoms. So it would be something that we recommend for them as well to have a gluten-free diet. But we'll talk about the celiac disease here. Then, so we red flags these people who have symptoms, and then if once they are confirmed their diagnosis with the celiac disease, then they would definitely need to follow a lifelong gluten-free diet as the treatment, and which is really important. They will need a lot of education on how to identify these glutens in the food, how to read food labels, how to do the cooking, how to avoid all the foods that has gluten. So it takes time for them to practice how to follow a complete gluten-free diet for lifelong.
It's quite restrictive, isn't it? When you think about that, no wheat. I mean, I can live with, no rye, oats, barley, but no wheat. Wheat is all pervasive, The entire human race eats wheat.
Well, the last 10
When you think,
years, it got a lot more gluten-free products in the market. Used to be very
yeah,
expensive, but now it's getting like more reasonable for the price. And a lot of people would choose gluten-free because of their personal preference. So it's pretty good.
mm,
So now you can see easily find a good gluten-free bread, gluten-free pasta or cereals. So easy to find these gluten-free product in supermarket.
mm. So let's just look at what foods contain a lot of wheat. So you've mentioned bread.
Mm.
So all bread, unless it's specifically gluten free, will have a lot of will have a lot of gluten in it. But not a lot of people realize the pasta is made from wheat, and therefore it's full of gluten.
Yes.
And another thing, like pizza bases, I know people who don't realize that pizza bases are made from gluten because it's still made from wheat.
Mm.
What other foods? Cakes and biscuits, they're all made from wheat. Yeah. So what other foods are commonly consumed that actually contain wheat?
Well, you just mentioned a lot of them. Absolutely right. Our bread, pasta, pizza base, crackers, biscuits, cakes, um,
Yeah,
and
yeah,
even some things like a hidden one, it's not so common. Maybe in Asian culture, we use soy sauce. We actually wheat is
yeah,
one of the products added to the fermentation. We use our cooking wine,
yeah.
the Shaoxing cooking wine. It got wheat used as a fermentation product. Also,
Hmm.
egg noodles. Yes, got wheat in it.
Yes,
Yeah,
noodles. Yeah, yeah, that's
noodles.
the other one, noodles.
Um,
Yeah. So it just demonstrates the all-pervasive nature of wheat in our world, where every society uses a lot of wheat. I don't know. I mean, maybe Eskimos and Inuit people they eat a lot of whale meat. Maybe they don't eat wheat, and because like you can't grow wheat. But anywhere where you can grow vegetables or you can grow wheat, that's what people eat, and it's just pervasive. It's really hard to exclude it from your diet.
it can be quite difficult. And I noticed that in Australia, probably is talking about 1 in 40 people is carrying that gene can potentially have celiac disease if something trigger them. Am I
Mm,
correct?
yeah, yeah,
Yeah,
yeah.
but it's less common
And
in country.
it's less common. What?
It's less common in Asian countries.
Right. I think it's also important to understand that celiac disease, whilst the genetic predisposition is there, and whilst the problem is there from birth, it may not actually present until up to your 40s,
Hmm.
right? And it may not actually present with significant gastrointestinal symptoms. It may present with these other manifestations like the glossitis and the skin rash and um, and the peripheral neuropathy. So there may be. So what I'm trying to say is there are gastrointestinal symptoms and there are extra gastrointestinal symptoms, and there's also a degree of severity. So some of them might be mild. So you might be just feeling, subpar for year upon year upon year. Then you might come up with an iron deficiency as a result of the malabsorption, and then someone thinks, well, why are you iron deficient? And then you've got gluten sensitivity or celiac disease. So you could be spending your a large part of your life consuming wheat and not knowing that you've got celiac disease and just feeling slightly off. So it's in that way it is a perfidious disease because not only does it come up upon you gradually, but it also means you can't eat a very, very common foodstuff. So it's it's perfidious. So let's talk about the gluten-free foods. You know, how do we actually deal with having to avoid gluten? So is there a wheat substitute?
Right. So, gluten-free diet, as you can tell by the name, we are trying to avoid anything containing gluten. And gluten is actually a type of protein that you can find in wheat, rye, barley, and in Australia will include oat in it as well. Um, the oat doesn't have gluten in it. However, the farm that we farmed oat is usually next to the wheat landfill. So there's a risk that they got cross contamination. That's why in Australia
Mm,
we will not say oat is safe to eat if people have celiac disease. Well, but in other country, maybe in the UK or other European country, they say they think oat is safe for them because they don't have the cross contamination issue. Hmm.
mm,
So first,
right.
people need to identify these natural food that has gluten in it. And then the next step, of course, it will be better if you can go to see a dietitian. Then you will receive information. I know a lot of people try to Google this information, and there's a lot of things on the internet. Maybe not all of them are right, so really need a health professional to guide you to plan your diet. So once people got a diagnosis with gluten celiac disease, they will be need to be very careful about going out to eat. When they're eating out, they probably need to plan ahead to research the menu, to contact the restaurant. Do they have any gluten-free options? Or it's really important when you get there, you have to tell the waiter, the waitress that you have celiac disease, so ask them to make sure the meals that delivered to you has to be gluten-free. And at home cooking is also very challenging or tricky sometimes. Sometimes if only one family member has celiac disease, they will need to have their own cupboard to store their food to prevent the cross contamination. Also, maybe you need to have your own toaster, um, use your own bread knife, or when you're having a jar of butter or a jar of like a jam or Nutella, you need to have your own. You can't share with your family members to prevent the cross contamination.
Yeah, so that sets a number of limits on people, and it really
Yeah.
makes you have to think very carefully and consistently about your diet and what food you're consuming.
Hmm.
Now, let's think about the role of gluten in cooking. So you quite rightly said that gluten is actually a protein. It's not a carbohydrate, as I might have suggested earlier on. So it's a protein, and it's highly absorbable protein. So it's one of the ways of actually getting a big source of amino acids from plants. But it makes food sticky
Hmm.
fundamentally. So when you're kneading dough, it's the gluten that makes the dough stick together.
Yeah. Yeah.
And I remember eating a gluten-free pizza once, and it was like eating cardboard. It was absolutely awful. And when I ate this gluten-free pizza, I thought to myself, my heart goes out to those who suffer from celiac disease. So what's your comment on this on the substitutes, the gluten-free substitutes these days? Because admittedly, I ate this maybe about 10 to 15 years ago. Have they improved?
Yes, I think they have improved because I had a similar experience like many, many years ago. I tried a gluten-free pasta and it just
Yeah,
tastes terrible. It just like
yeah,
very different. But now these gluten-free pasta, they're doing much better. I would say you can't really tell much difference. And I know that some
really.
ingredients they were added to it to mimic the gluten's function in the food. So it gives you the elasticity to in the food. So give you that sticky or thickener functions. So it got something to replace the
Yeah.
gluten now.
All right. So it's not as bad. It's more palatable. Maybe I'll try another gluten-free pizza. But it really made me feel very sympathetic to the plight of those millions of people out there that are suffering from celiac. Now let's move on to the Asian culture because you're Asian, you're a specialist dietitian, and so you have a special interest in providing dietetic advice to the Asian community. So, what would you advise specifically in the Asian community um, to help people with celiac disease?
Yeah, so in the Asian cooking, I mentioned earlier that there's a lot of condiment sauces that might have wheat in it, like our soy sauce,
Mm,
oyster sauce, or even cooking wine that we use commonly in our cooking.
mm,
But lucky
yeah.
that these all have the gluten-free options, so which is good.
All right.
Yeah, so but the other things like when we plan for the cooking that we need to know about really have to avoid any the dough, the flour that's come from the wheat. We do use like rice flour or other like a maybe bean made flour, mung bean flour, these things to replace the wheat flour. But as mentioned, the downside
Mm,
is like they don't have the elasticity in it. So I have the experience when I'm using this flour to make bread or make other food. They just feels like it can break easily. They don't have the
mm,
elasticity, but they will add some other replacement in it. Ingredients called the sanfan gum. They will add it to it to improve the texture to mimic the gluten function. So which is good.
yeah. So I didn't know that soy sauce and oyster sauce had gluten in it, and I certainly didn't know that rice wine had gluten in it. But does rice per se have gluten in it?
No, rice is gluten free,
No.
and that's why we use like
Right.
rice noodle to replace other like egg noodles or other wheat
Yeah.
noodles.
Yeah. 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 So you can eat, and I suppose thinking about it, you can eat South Asian food quite well without having to have gluten because, certainly in Indian, Pakistani, and Bangladeshi cultures, there's a lot of rice, there's a lot of vegetables. You can legitimately go without bread and wheat there, and it must be the same in the kind of the Chinese, Southeast Asian communities. You don't need to eat bread as part of a culture in that part of the world. Whereas, in Europe, in Paris, for instance, if you said, you're not eating bread or you're not eating wheat, that's a big problem. If you go to Italy and you're gluten sensitive, then you're not eating pizza. That's a big problem.
Yeah, no pasta as well.
So it really does, yeah, in the pasta. So perhaps it doesn't highlight itself quite so much in Asian and Southeast Asian cultures.
Yeah, definitely. We can have rice
Yeah,
and
yeah,
other options.
yeah. Now, are you prone to with a gluten-free diet? Are you prone to any specific micronutrient deficiencies?
Yeah, so in the long
Yeah.
term, if people didn't know they have celiac disease and they have been eating gluten for very long time,
Mm,
um,
mm,
I noticed that they usually what happen is they can first identify they have iron deficiency. So, and then maybe
yeah.
like folate, iron, and certain vitamins, like you mentioned, fat soluble vitamins, ADEK.
Mm,
Um,
mm,
Usually start from the iron first. So, because it's also one of the symptoms, people might feel very tired, just feel
mm.
like anemia is one of the symptoms people might have if they have celiac disease.
Yeah,
So that's something that when we see,
yeah.
we red flag, and then we'll recommend to have a blood test, get it done, and check, do you really have celiac disease?
And once you've diagnosed celiac and once you've got someone on a gluten-free diet, is it fire and forget, or do you need regular dietetic checkups?
Yes, definitely you need a regular dietetic checkup. So
Hmm.
because once people got diagnosed with celiac disease, they will need to start changing their eating habit, try to learn what food has gluten and what things you need to avoid. So it takes time for
Mm,
them to slowly practice, and some people started can be quite panicking about like they don't know and they restricted their diet quite significantly because they're so scared that might accidentally eat some gluten. So that would be good to see a dietitian first, so that you can learn. There's a big list for you that still have a lot of food you can eat, but you just need to be careful about the cross contamination. Hmm. And the good thing is
Yes,
like a lot
absolutely.
of gluten-free products made it, the bread, the pasta, all have gluten-free options. So reading the food labels is another
Yeah.
really important skills.
I mean, I'm reminded by what you say of the fact that the commonest two causes of treatment resistant celiac disease is actually poor compliance and cross contamination. Just not sticking to that absolute ban from all gluten products. And it's so easy for food to be cross contaminated. If you think of flour, right? I mean, if you open a bag of flour in the kitchen, a lot of it will end up in the atmosphere, and that could end up from the atmosphere straight onto someone else's plate who might have celiac disease.
Yeah.
So and certainly there's certain kitchens that I know, the professional kitchens, where they actually have different rooms entirely, to wash the dishes or to process the dishes for those who have celiac disease and those who don't.
Yeah.
It is so easy to get cross contamination.
Yeah, even at home, it's strongly recommend that you should store your gluten-free products separately. Yeah, and
Hmm.
try to use
Yeah,
separate cooking equipment.
yeah. Well, Charmy, I want to thank you for your time today. Unfortunately, we've run out of time, but I really look forward to speaking with you again very soon. Thank you. That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Lifestyle Matters.